to Body Beautiful. Right now we're talking with Dr. Elizabeth Lee about neck lift surgery. We'll be taking your calls with any questions you have. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. And remember, this is a caveat. We have to give every break or so. Any advice we give you today, you certainly want a second opinion. Yeah, particularly if you're going to go in for any type of surgery.
Absolutely.
Just check it out. We've got some pictures. So let's go ahead and roll those pictures so people can get an idea what you're talking about here. So go ahead and roll the first before and after. And again, we had these cropped closely to protect the identity of the person here.
Right, and what you can see on the top here are the preoperative pictures, both the front view and a side view. And what you see below is the post-op picture, where you have tightening of the area underneath the chin, tightening of the angle between the neck and the jaw.
So more definition.
More definition, and that's a more youthful look, and it's also very natural looking, which is what's important.
And subtle. I mean, you wouldn't necessarily know that somebody just had a neck lift by looking at this.
You know, it's the kind of thing that my patients report to me they're very pleased about, because people say, you look great. Did you lose weight? Are you exercising? Are you sleeping more? What's happening? And they don't just say, well, look at that. You had a neck lift. Who did it?
Exactly. And that's something you actually take pride in. You don't want your work to necessarily show.
Right.
Okay. Let's
Not
go ahead
great for marketing, but in terms of word of mouth.
Subtlety is your business.
Yeah.
Let's go ahead and roll another picture here. I think we have a gentleman. Oh, no, this is another woman. Okay.
And this is one of my patients who actually had had a huge amount of weight loss, which she did on her own, over 100 pounds.
Fantastic.
And she was left with all that sagging skin. So this is a very natural looking result. She's in her 40s. Okay. And she's thrilled.
Now, would that skin have actually kind of
contracted on its own
by itself?
No,
after a while?
She was sometimes skin does, and that's very variable from person to person. In her case, she had maintained this body weight for 5 years, and that skin was still loose.
And it was still loose. Okay.
Right.
And was there any liposuction done, or was it just plastic surgery?
Well, it wasn't mostly. There might have been some liposuction done, just as what I call a final tailoring. So when I'm done with the actual surgical procedure, there may be little areas of lumpiness that I can tailor with a very small cannula. But this is a neck lift procedure, which is done with incisions, one underneath the chin, and then incisions in the crease behind the ear.
So we're talking about micro incisions. These aren't.
No, they're not huge incisions, but they're probably about an inch. Okay. In both directions.
And it's hidden where?
It's in the crease underneath the chin, in that area where a lot of us carry scars from childhood.
From, jumping off the diving board
backwards. Right. Yeah.
It's my story, and I'm sticking to it. No, it actually did happen. Okay, so there, and then behind the ears, or depending on what's done?
Well, it depends on what needs to be done, but a classic neck lift, at least what I consider to be classic, is a procedure that improves the skin and the laxity underneath the jaw. And so those incisions are about a 1 inch incision underneath the chin and an incision in the crease behind the ear, so that it's hidden.
Now, I'm a little bit confused, and maybe you can clarify this. Is that also considered a mini facelift when they take a little bit of the lower portion of the
Well, definitions vary depending on what surgeon is doing what and who's described it. But when I'm talking about neck lift with an incision only behind the ear, what I'm talking about is a procedure that improves from the collarbone up to the inferior border of the jaw.
Okay, we're looking at a picture right now. Maybe you can talk about this gentleman. He's trying to hide it with his goatee, but we can see that something's happened here.
Yeah, and this procedure is also something that can be done in men with very, very nice natural looking improvement.
Yeah, there's nothing worse than looking at a man and seeing that he's had plastic surgery done, and we are seeing more and more men have it done. But in this case, it's not just the goatee that's hiding the work. Actually, it's just, and it's really subtle.
Yeah.
You wouldn't be able to.
But what he was concerned about the way his neck looked over his collar, and it's a lot better now. He's more comfortable wearing a tie to go to work, which was really something that was concerning him.
Very quickly, do we have another photo that we can flash before we take the break? No, is that it? Oh, one more. Okay. And now this is
a pretty extreme
almost like
case.
A different person.
Right. Right, and you know, this woman had an enormous laxity. We kind of unnicely refer to this as a turkey gobbler. And you can see in this front view how much tightening she got just with incisions. Now, she did have some work done in the front, so if you look at the line, which we call the marionette line that goes from the corner of the mouth down to the jaw, it's better in the below picture, because so that's kind of the mini facelift that you were alluding to earlier. So that if incisions are carried out in front of the ear, also in the crease right in the front of the ear, that we can improve the lower half of the face.
Okay, we need to take a quick break, but for more information about neck lift surgery, you can call Dr. Lee's office at 510-704-2170 or check her out on the web at artfulsurgery.com. When we come back on Body Beautiful, we'll continue chatting about neck lift surgery and any other types of plastic surgery questions you have. We'll be right back.